Dr. Kirsten Lewane coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And I have several young athletes that I have been treating here in the office for a condition known as Osgood-Schlatters. Maybe you've heard of that condition before. It's very common in our younger athletes who are going through sudden growth spurts and who are involved in sports that involve a lot of running or jumping, those type of activities. That's what leads to this condition called Osgood-Schlatters. And it's really more of an overuse type injury or overuse type condition rather than a disease, even though it's called Osgood-Schlatter disease. It's not really a disease, and it is something that will self-resolve with time. But today I'd like to cover 3 easy stretches that you can be doing to help with those symptoms as you're experiencing them, because you can be looking at anywhere from 6 to 24 months of symptoms depending on, the growth spurts. So it really goes along with the growth spurts and sudden changes in height, and then the activity level and what types of activity that these young athletes are doing and how repetitive that is. So let's go ahead and cover 3 easy stretches to help with Osgood-Schlatters in the management of it. There's some other treatment management options as well, but today we're just going to talk about the stretches. So the main muscles, first of all, Osgood-Schlatters involves, it's typically right down here you have your patella, your kneecap, your patellar tendon, and then right at the bottom of that patellar tendon, it's an irritation of the growth plate, really of the tibia, and then in that area where the tendon attaches to the tibia, that develops, there's irritation here, inflammation, and you'll see a noticeable bump in several of our athletes that have Osgood-Schlatters, and that bump can continue to become enlarged as they're experiencing this condition. And that bump will actually, it's not something that just goes away, although the pain in the knee does eventually go away. So that's what we're talking about. So the muscles that we want to go ahead and stretch, the exercises or stretches that we want to do to help with this condition are going to be for the quad, because the quad pulls on that patellar tendon. So we want to stretch the quadricep or front of the leg muscle. We want to stretch the hamstring, the back of the leg muscle, as well as the calf. And so you may be doing some of these stretches with your athletic activities, but these are stretches that you can be doing at home as well to support in the management of Osgood-Schlatter pain. So we're going to actually do a contract relax type of stretching today. And the first tool I'm going to utilize is a Theraband. Now this is just a band that you can get off of Amazon or at your local sporting goods store, and we'll pop a link down in the comments where you can find that. There's different strengths to the different bands based on the color. So it's really going to be based on what works for you. I'm starting with a pretty light band just to show you this. Another option is there are pull-up type assist bands. They're a full loop. They have a lot more tensile strength to them. So they're going to provide more resistance and more as you're pushing into it for the contract and then stretch as you're pulling on it. You can also use a strap, really anything that you can get around your foot to help you, a long towel, to help you with the stretch as you go through it, okay? But what I like about the Theraband is that we can do some contraction with it as well. So let's start with the quad. And we're gonna go ahead and I'm gonna wrap this around my foot and hold on to that. And then I'm gonna lay down on my belly. And you can see that if I pull on the Theraband, I'm bringing my quad, my knee bent, that's a stretch to the quad. So the contract portion is going to be, I'm going to resist, push against the Theraband to get some resistance. And then after I've done that, I'm going to let that come in and stretch and relax, or let that quad muscle stretch. And I'm going to go ahead and do this 3 times, but I'm holding the stretch for 30 seconds. And after you've held that stretch for 30 seconds, we're going to go ahead and we're going to contract again. And then relax. And you'll notice after each contraction that you're able to get a little bit more stretch, just a little bit more. That's all we're going for. A nice deep stretch in the front of that leg muscle. So contracting against the resistant band and then stretching, okay? So that's the one for the front of the leg, the quad. Then we're gonna move on to the hamstring. So again, I have this around the bottom of my foot. Now for the hamstring, your stretch is gonna be up here. So how are we gonna contract? We're gonna go the opposite direction. So I'm gonna push into, I'm putting some resistance on the Theraband and pushing away. And then once I've contracted, I'm gonna bring it back into my stretch. And you'll see my legs shaking a little bit. That's normal. When you're stretching a tight muscle, the hamstrings tend to be tight on all of us because we do sit a lot. So holding that stretch, again, I want you to hold them for 30 seconds. And then you'll go back into a contract position. And then next time you should be able to bring it up a little bit further into that stretch. And again, we're going to do this 3 times for the hamstring muscle or the muscle on the back of your thigh. Contract and relax, stretching that muscle, okay? Finally, we're going to finish up with the calf muscle. So putting my legs straight, and I'm going to make sure this Theraband's a little bit more around just my forefoot, the upper part of my foot here. Providing some stretch on that Theraband. To contract, I'm going to push my toe down. And then I'm going to bring my toe back up towards my knee, my head, back towards me. To get a stretch, you're bringing that toe up in the calf muscle. Holding that for 30 seconds. And then repeating 2 more times with a contraction, resistance, and you can provide more resistance by pulling harder on the band or using a stronger band, and then bringing it back and relaxing for the stretch. 3 times. Contract, relax. So that is 3 easy stretches that you can be utilizing at home to help manage the symptoms that are associated with Osgood-Schlatter for our younger athletes. If that's something that you're having trouble with, go ahead and put these into your daily activities so that you're helping to manage that pain in the knee. If you have any questions about this video, go ahead and pop those in the comments below. I want to thank you for joining. Please, if you haven't subscribed yet to our channel, go ahead and hit the subscribe button as well as the bell notification button so that you get future notification of videos that we're continuing to release here on the channel to help you move well and live well. And more than likely, you know of a young athlete that either is having knee pain or is wondering, do I have Osgood-Schlatters and has that bump on the front of their knee, and they're looking for ways to help manage that. So go ahead and share this video with them. Gives them the ability to do some stretches to help manage that pain. And again, I do want to thank you for joining us. Give us a thumbs up if you found value in this video. Thanks again. I'm Dr. Kirsten Lewane coming to you from River Valley Chiropractic, where we teach you to move well and live well. Have a great day. Bye-bye.